With regards to pharmacovigilance and signal detection, there is a significant overlap of drugs and vaccines in the methods and approaches used. However, there are some important differences which are worthy of attention. I would like to highlight some of the important points here. I would say one of the most important element that we should see is age implication. Well, we all know that pediatric vaccines are often administered to healthy infants and children at certain ages. Now, there are a lot of diseases that happen concurrently or nearly so with the vaccination. So, we should always take that into account when we are doing the causal association and drug certifications. Secondly, settings of vaccine administration also plays a very important role. Now, in the mass vaccination campaign, sometimes some of the known serious events like vasovagal syncope can be reported as rather serious events in the absence of medical confirmation. In clear contrast to drugs, vaccines are actually known to cause immunity. They in fact prevent disease, they induce infection, and thereby cause immunity. Now, it's very important that sometimes these infections, which are generally mild in nature, can actually be serious. So it's very important how to investigate those diseases. For example, aseptic meningitis can be caused by mumps virus. So the investigation of these organisms, either by culture or recombinant technology, is very, very crucial in making a causal association assessment. Another important aspect of mechanism of vaccine is, as I mentioned, vaccines cause immunity. But sometimes this immunity can be pathologic. For example, MMR vaccines are known to cause autoimmune thrombocytopenic purpura, or some vaccines cause autoimmune hemolytic anemia. So again, these are kind of things which you expect in vaccines, and not so commonly in drugs. Now, also vaccines are given concurrently with other set of vaccines. So sometimes it becomes difficult to pinpoint the causal association of a particular vaccine with a particular disease. Analysis by lot or batch also assumes a lot of attention in the vaccine arena. Sometimes we have to take a call whether we should do the analysis of the same types of vaccine together or separately. Also, sometimes the databases are mixed. So, one of the most important challenges that we see is that the ADR data from the vaccines may be much, much lower than what we have in the data from the drugs. So, when we do the comparison of the age group population, it becomes very important that we are doing the decision correctly. For example, if you're taking a pediatric population and comparing with, say, elderly population, we may not be able to get the right or appropriate data actually in terms of signaling. Also, it's very important that we are actually looking into the right signals. Sometimes the class effect can be identified. We at AWINSA Life Sciences have a team of experienced pharmacovigilance professionals who support our clients in the signaling process not only for drugs but also for vaccines.